In this video, we will explore COVID-19 in detail. We will help you understand some of the words and myths about this disease. Let's start by talking about what COVID-19 is. COVID-19 is a highly infectious respiratory disease that has spread across the world. Because of how many are affected, almost everyone is talking about this disease. You will hear lots of words used when people talk about COVID-19. Let's take a look at some of the words that are used the most. Outbreak. An outbreak is an increase in the number of cases of people infected by a particular disease. Epidemic. An epidemic happens when there are many outbreaks outside of the first outbreak within the same country. Pandemic. A pandemic is an epidemic that affects people across the world. COVID-19 has been classified as a pandemic because people in different parts of the world have this disease. Social distancing. Social distancing means to keep a distance between yourself and others. One of the ways of doing this is by not taking part in any kind of social events. Quarantine. If someone is put in quarantine, they must stay away from everyone for a certain period of time until they know their COVID-19 status. Quarantine must be practiced by people who might have been exposed to COVID-19. Even if the person doesn't have any symptoms, they must be put in quarantine. Self-quarantine. When someone is on self-quarantine, they choose to stay away from others for a period of time. In other words, they do it voluntarily. Mortality rate. Mortality rate is the number of people who have died from a disease. Although South Africa has a low mortality rate and a higher recovery rate for COVID-19, it is still important to take precautions. Flattening the curve. Flattening the curve means to take protective measures in order to slow down the rate of infections of COVID-19. Some of the best ways to flatten the curve is to work from home, close schools or switch to online classes, get in touch with family and friends through technology rather than personally, and cancel or postpone all social events like conferences, weddings, and sporting events. Now let's talk about myths and misinformation. A lot of information about COVID-19 has been circulating. Unfortunately, not everything that is said about COVID-19 is true. Let's look at the most common examples of misinformation about COVID-19. The virus dies at a certain temperature. This is false. The virus can spread in any environment unless it has been disinfected. COVID-19 can spread through blood. This is not true. COVID-19 is a respiratory disease that spreads through saliva and respiratory droplets, not through other bodily fluids. People often ask whether using a mask and gloves is needed. The Center for Disease Control recommends that everyone 2 years and older wear a cloth face mask that covers their nose and mouth when they are out in public. However, here are a few groups that should not wear a face mask. Children younger than 2 years. This is because of the danger of suffocation. Anyone who has trouble breathing, is unconscious, cannot move, or is unable to remove the face mask without assistance. Please wear your face mask in addition to following COVID-19 safety guidelines. The purpose of a face mask is to prevent those who may be infected with COVID-19 from spreading the virus to others. This would be especially important if you are infected but do not have symptoms of COVID-19. Shops and other public service places reserve the right to refuse you entry if you are not wearing a mask, in order to protect those on their premises. Please remember that medical face masks and N95 respirators are reserved for healthcare personnel and other first responders. If you are feeling sick, stay at home and contact your doctor for advice on getting tested. For more information, visit www.who.int/coronavirus or contact the 24-hour public hotline at 0800 02 9999. Let's continue working together to stop COVID-19.